Good evening. To build on what Dr. Davis just discussed, I'd like to share with you information about the expert panel convened by the FDA and CDC to assess the safety of the Johnson & Johnson vaccine. As we all know, on April 13th, FDA and CDC recommended a pause on the use of the Johnson & Johnson vaccine. The CDC's Advisory Committee on Immunization Practices, made up of medical and public health experts, met to review available data on the cases of TTS and make a recommendation on how to proceed. At that time, the committee felt it didn't have enough information to make a recommendation and reconvened again last week. The data reviewed by the committee included reports submitted to the Vaccine Adverse Event Reporting System, the medical literature, and information from global regulatory partners about TTS that have been reported following use of a similar yet not identical COVID-19 vaccines. As a result of this review, they determined that the pause in the use of the Johnson & Johnson vaccine can be lifted and that use of the vaccine should resume. The FDA and CDC concluded that the vaccine is safe and effective in preventing COVID-19 and that the potential benefits outweigh its known potential risks in people who are 18 years of age and older. Available data suggest that the chances of TTS occurring is very low. In women ages 18 to 49, the risk of developing this condition is 13 cases for every million vaccines given. At the same time, the benefits of the vaccine included preventing 12 deaths, 127 ICU admissions, and 657 hospitalizations. In women over 50, the difference in risks and benefits is more dramatic. The risk of developing this condition is 2 cases for every million vaccines given, and the vaccine would prevent 593 deaths, 1,292 ICU admissions, and 4,794 hospitalizations. All vaccines and medications carry with them risk. However, the effectiveness of the COVID-19 vaccine in preventing death and serious illness was 100% in clinical trials across all brands. After initial development, vaccines go through 3 phases of clinical trials to make sure they are safe and effective. During phase 1, small groups of people receive the trial vaccine. In phase 2, the clinical study is expanded and vaccine is given to people who have characteristics such as age and physical health, similar to those for whom the new vaccine is intended. In phase 3, the vaccine is given to thousands of people and tested for efficacy and safety. The clinical trials for COVID-19 vaccines have involved tens of thousands of volunteers of different ages, races, and ethnicities, and compared outcomes, such as how many people get sick, between people who are vaccinated and people who are not. Because COVID-19 continues to be a public health crisis, the vaccine clinical trials were conducted more quickly than if the disease were less common and less widespread, but every phase was complete. Results from these trials showed that COVID-19 vaccines are effective and that there were no serious safety concerns after more than 8 weeks following vaccination. We are grateful to have a federal safety infrastructure that is continuing to carefully monitor the safety of vaccines. The health and safety of all who live in the U.S. is of the highest priority, and this monitoring will continue as hundreds of millions of people are vaccinated to prevent infections, serious illness, and death from COVID-19. Here at Public Health, we will continue providing you updates about the safety and efficacy of the vaccines and what that means for vaccination efforts in LA County. Thank you. And now I will turn it over to Dr. Seira Kurian, Director of the Division of Medical Affairs, who will share more information about getting vaccinated in LA County.
Thank you, Dr. Balter. As noted, I'll spend a little time speaking with you about the vaccination process and what to expect before, during, and after you get vaccinated. First of all, we want to share the news that LA County mass vaccination sites are currently welcoming individuals even without an appointment. Anyone 16 years of age or older who lives or works in LA County can simply head over to one of our sites as soon as you can while supplies last. You can find all location information on our LA Public Health social media channels, as well as on vaccinatelacounty.com. Please note that 16 and 17-year-olds must find a site that offers the Pfizer vaccine, which our mass vaccination sites are offering currently. We encourage everyone who's eligible to make your appointment now. It's your turn and there's no reason to wait. Go to vaccinatelacounty.com to choose from hundreds of appointments near you. The sign-up process is simple, free, and quick. Making an appointment is much easier now that supply is up and we have hundreds of partner sites to choose from across the county. Many have no wait times and no lines, so it's never been easier to get in and out quickly and conveniently. Please make sure to note whether you need 2 doses, which you need with Pfizer and Moderna, or just 1 dose with Johnson & Johnson. Do your best to show up to your second appointment on the date scheduled if you've been vaccinated with either Pfizer or Moderna. Before both appointments, make sure to drink plenty of water and stay hydrated, and eat and take your regular medications. You may even want to bring water and a snack with you just in case you need it. As a side note, it's not recommended that you take over-the-counter pain medications such as ibuprofen, acetaminophen, aspirin, or antihistamines before your appointment unless these medications have been recommended by your provider for other medical conditions. At check-in, you can expect to show a photo ID, proof that you live or work in LA County, and proof that you're over the age of 16. You will not be asked to pay money. You will not be asked about your citizenship status or job. The practitioner will provide you with your vaccination card, which is important to hold on to. We suggest putting it in your wallet or purse and keeping it secure and safe alongside other important personal items. If possible, you might want to take a picture of the card as well so you have a photographic copy. Immediately after you get your shot, you'll be asked to wait for about 15 or 30 minutes for observation before leaving the vaccination site, just to make sure you don't have any immediate reactions to the vaccine. Typically, those who have a rare allergic reaction, such as having trouble breathing, will display it within minutes of receiving the vaccine. Again, this is rare, and if an incident does occur, rest assured that each vaccination location has support staff to respond and treat any individuals in need of help. We know people are concerned about vaccine side effects, and we understand that concern. The reality is the majority of side effects from getting vaccinated are minimal compared to what can happen if you actually get infected with the COVID-19 virus. Everyone reacts differently. Some have absolutely no symptoms whatsoever, while others have 1 or 2 minor symptoms that last a short time. And still others may feel mild flu-like symptoms lasting no longer than a few days at most. Side effects after your second shot may be more intense than the ones you experienced after your first shot. These side effects are normal signs that your body is building protection and should go away within a couple of days. Remember, if you experience side effects such as soreness or redness around the injection site, some muscle soreness, tiredness, or mild fever within the first few days after you were vaccinated, these are most likely just side effects of the vaccine. If, on the other hand, you're experiencing symptoms such as cough or new onset of loss of taste or smell, please consult with your provider because these are less in line with side effects from the vaccine, but may indicate that you have actually come into contact with someone that had COVID. It is important to note that you cannot get COVID from the vaccine itself, since there is no COVID virus in the vaccine. See a doctor if your side effects are worrying you or do not seem to be going away after a few days, especially if you're experiencing symptoms like shortness of breath or chest pain. It takes time for your body to build protection after any vaccination. You are considered fully vaccinated 2 weeks after your second dose of the Pfizer or Moderna vaccine and 2 weeks after the single dose of Johnson & Johnson vaccine. Only then will you reach the full protection provided by the 3 approved vaccines, which all offer a very high effective rate, protecting people from hospitalizations and death from COVID-19. Even after you've been fully vaccinated, you should keep taking precautions in public places, like wearing a mask when indoors, around others, or in crowded spaces, staying 6 feet apart from others, avoiding crowds in poorly ventilated spaces, and washing your hands often. So make an appointment today and bring your family and friends along with you. You'll be fully vaccinated within a matter of weeks, and that will go a long way towards herd immunity and getting back to our normal lives. Thank you.
Oh, thank you so much, Dr. Kurian, Dr. Balter, and of course, Dr. Davis. I'm going to start. I have a ton of questions that have come in. I'm going to direct questions to one of our physicians here, but obviously, any of you feel free to jump in on any of the questions. And again, thank you so much for everyone who sent in their questions. These are all really important questions, and we're glad to have an opportunity to be able to do our best to answer them. The first question, Dr. Davis, I think maybe you can get us started with this. It's from a woman who says, I want to get the Johnson & Johnson vaccine because I only want to get one shot, but I'm worried because I'm a 40-year-old woman. Should I take a different vaccine?
It's a great question, and I think it's something that each of us, looks at as we looked at the different vaccines that are available. What I do want to point out in terms of the Johnson & Johnson vaccine, the incidence of what we just described earlier is rare, and it is something to be aware of, or at least to know about, and something to be aware of the symptoms. Should you get the Johnson & Johnson vaccine, and within 3 weeks you start to experience those symptoms, because it's very different in terms of how it's treated. If you have those symptoms and you're going to get treated by the provider. So it is really, again, a personal choice, but I will stress that the risk is rare. But if you don't feel comfortable in that regard, there are other options that you can get. But it is a very safe vaccine, again, very rare in terms of the occurrence of TTS, and can be treated if recognized early on.
Oh, thank you so much, Dr. Davis. The next question, maybe Dr. Balter, you could get us started. I am fully vaccinated. Can I still get COVID-19? Have there been a lot of cases of people getting COVID after being vaccinated?
That is an excellent question. And to be clear, the goal of the vaccine is to protect people primarily from serious illness and death. But it does protect most people from COVID, but you can still get COVID. People who get COVID after vaccination do not have a serious illness from COVID. So sometimes they may have no symptoms at all, which is why we still do recommend some caution when you're around people who are highly vulnerable. But although it's possible to get COVID, you're very unlikely to get very sick from COVID. So that's really the important part.
If I can add, I think, what has been seen in terms of the data and people getting COVID after vaccination is often between the first and the second dose, or shortly after the second dose, which means they didn't have the full protection and they were exposed to the virus, which took hold before the vaccine could protect them from infection. So I think it's important to point that out. Even as you're getting vaccinated, you still need to take precautions in order to prevent infections.
Yeah, thank you so much. Dr. Kurian, I have a question. My brother, wife, and nephew want to get the vaccine, but they don't have any proof of residency. They live with me and my fiance. Do I need a notarized affidavit of residency, or is there something easier for us to get?
It's a really good question. And so it is important to note that we're accepting a wide range of documents that can be used to prove that you're either living in Los Angeles County, including a self-attestation letter. So we have templates of these letters available on our website, vaccinatelacounty.com. So you can fill them out, print it out, and bring them with you to get your vaccine. So again, I would recommend that folks check out the website because you might be surprised. There might be some documents there that you might actually have to help you with this.
Yeah, and again, I want to just note, the answer is, do you need a notarized affidavit? Absolutely not.
Yeah, no.
You can look through that list, you can bring a phone bill that's addressed to you at that address, at some address in LA. You can bring an electric bill. But if you don't have any of those, you really can just sign a piece of paper that says that you affirm, that you say with all of your honor that you, in fact, live at that particular address. So that should not be for anybody a barrier to coming in and getting vaccinated. So again, the same thing, we do ask for a photo ID. It doesn't have to be a government ID. So I want to reassure people, you got a work ID, you got a library card with your picture on it, you're a student and you have a student ID with your picture on it. Those are all perfectly acceptable ways of establishing your identity. What we don't want is for that to get in the way of your coming in and getting vaccinated. So thank you so much, Dr. Kurian. And then we have so many questions, so I'm going to move quickly. Let's go. A follow-up to that was, and we'll just stay, Dr. Kurian, if you don't mind.
Sure.
Can I get vaccinated if I don't have any ID at all?
So absolutely, our vaccination sites are making accommodations for people who are experiencing homelessness, for example, who may not have any records or documents with them. So our sites are, aware of the fact that there might be individuals in those situations. But as Dr. Ferrer noted, ideally we would like folks to come in with, sort of three main items, which can possibly be found all in one document. A photo ID, again, it doesn't have to be government issued, just something with your picture on it and your name so that we know that we're vaccinating the right person. Something that says that you live or work here in LA County. Dr. Ferrer mentioned quite a number of them. And again, you can just, fill out that attestation form. It does not need to be notarized. And then something that proves that you're over the age of 16, because of course we just don't want to make sure, we want to make sure that we're not vaccinating somebody for whom the vaccine is not approved for yet. So yes, if you're in a situation where you don't have those documents, our vaccination sites are really trying to be as accommodating as possible.
Yeah, if you want to get vaccinated, come in. We'll figure it out with you. And you do need to be 16 or older. So that is, and we have a great question. So maybe Dr. Muntu is, why is the age for vaccine cutoff at 16 years old? Is there that much of a difference for my son who's 15 and looks like he is 16? And he does have underlying conditions, so I'm anxious to get him vaccinated.
Yeah, this goes back to, how medicines and vaccines get approved. It's really about studying the efficacy or the effectiveness of the medication or the vaccine and the side effects that may show up in relationship to whatever medication or vaccine is taken. And it's done within age groups. So there is active studies for those who are younger than 16 to now see if the vaccine is as effective and if there is the same profile in terms of side effects in younger population. But you can only approve something for the population with which it's been tested. And I will point out that typically testing doesn't start with kids. It doesn't start with pregnant women, just because the risk is so much higher there, just in terms of their age and their condition. So generally starts with the general adult population, sometimes tips down below 18, as this one did, and then starts to go to pregnant women as well as children in terms of the studies.
Thank you so much, Dr. Davis. And there's a great follow-up question. Maybe Dr. Balter, you could help with this. I'm pregnant and I'm not sure if it's a good idea for me to get the shot. Is it safe?
That is an excellent question. As Dr. Davis alluded to, vaccine trials generally don't start with pregnant women. So we don't, unfortunately, have the same kind of data that we have for everyone else. We are gathering data from women who choose to be vaccinated. The evidence so far is that it is safe in pregnancy. And there's more and more evidence that women who are pregnant are actually at higher risk for poor outcomes, for hospitalization, serious illness, and in rare cases, death, compared to other women of their age. So it is a complicated question for each woman to consider how comfortable they are getting the vaccine. We do recommend that if you're pregnant, you have a conversation with your obstetrician or other provider about whether or not you should get the vaccine. But we are definitely offering the vaccine for women who are pregnant, and we urge everyone to consider getting it.
Yeah, it's such a great question, and there is, like the good thing is there's been thousands and thousands of pregnant women that have gotten the vaccine, so we do have a lot more information about that. There's also been thousands and thousands of women, who got sick before we even were offering the vaccine, and one thing we do know is that there's higher risks for women who are pregnant and do unfortunately become ill with COVID-19. They have higher risks for themselves and their own health, as well as for health of their unborn child. So it is good, as Dr. Balter mentioned, to please talk with your physician or your clinician about making that decision, because there is just, we're lucky now because there's so many women that have really helped us gather information about both the impact of COVID-19 on your pregnancy and as well as the impact of getting vaccinated. We're feeling very hopeful that as time goes by, there'll be a lot more information for everyone to be able to look at. Dr. Kurian, I wanted to, there is another question here for someone who says, I want to get the Johnson & Johnson vaccine, but how do I know where I should go to get the Johnson & Johnson vaccine? I'm only interested in getting Johnson & Johnson.
Great question. So again, if you go to our vaccinatelacounty.com webpage or website, we do have listed all of the vaccination sites, which vaccine is being offered. So you can see which sites offer which vaccine, but again, our recommendation is that, the best vaccine is the vaccine that's available. So if you go to a site that has Johnson & Johnson and you're having a tough time getting an appointment, we highly recommend and encourage you to access whichever vaccine has appointments available for you.
Yeah, Dr. Kurian, I'm going to just stay with you because, we just have question after question pouring in on people who are trying to figure out if they can get vaccinated. So
Sure.
My Thai wife, who's here on a B1, B2 travel visa, and myself, I'm a USA citizen, would like to get vaccinated together. Is she eligible? I reside in Gardena, California.
So yeah, again, if you're living or working here in LA County, you are eligible for vaccination. They are not going to be asking you about your immigration status or for proof of any documentation that you're here with some sort of immigration paperwork. So if you and your wife have, even just that letter that you can download from our website that proves that you live here in LA County, that should be sufficient for you to get vaccinated.
Thank you so much for sharing that with us. There's tons of questions, and we're going to try to get to as many of these questions about who can go to get vaccinated and where can you go as possible. There's a question here, Dr. Davis, that maybe you could help us with it, because there's actually a few questions around this. Let's just start with how much immunity does the first shot of Pfizer offer? Dr. Davis?
Yes, and I'd probably ask Dr. Balter to chime in on this as well. I mean, this is something that, they've looked at and can be anywhere between, I believe it's between the 60 to 80% in terms of the population. And then after you get that second dose, that's when you start to see the efficacy that was seen in the studies. But in either case, what is authorized is for the 2 doses. So we do not recommend that someone take the first dose and then not get the second dose. You will not get the full benefit that was studied in terms of the vaccine. Dr. Balter, I don't know if you want to add anything related to that.
No, I think that's correct, that those are the estimates for efficacy. And then I think, as you alluded to earlier, it's important for people to realize that if you are exposed to the virus before you are vaccinated, you may get the virus anyway because you haven't had any protection yet. But then if you've only had 1 dose, there's still a higher chance that you could become infected if you are exposed to the virus than if you have 2 doses. So we do recommend strongly that you get both doses of vaccine.
Dr. Ferrer, you're on mute. Yeah.
Oh, sorry. Well, with the Pfizer and Moderna vaccine, Dr. Balter, maybe you can just go ahead with the next question. With the Pfizer and Moderna vaccine, are we all going to need a booster in 6 months? And how are we going to know? And how are you getting ready to make sure we get our boosters? I'm putting all these together. Sorry.
Yes, this is a fantastic question. The answer is, as so much with COVID, we do not know. Everybody is watching very closely. Both companies have announced that they're preparing to create a booster if it's necessary. And the way you will know is that we will message this to you in much the way that we've been messaging all year, the need to get a booster. I think we're working in terms of how you will get your booster. I think there are the mechanisms that we've used now, and I think also all teams and everyone is working to make it easier and easier to get vaccine going forward in the future. So although we don't know, there's definitely a chance that will happen.
That's great. Dr. Kurian, there's again a few questions about, access to vaccines. One is, I'm homebound for medical reasons. How can I get vaccinated at home?
Great question. So our teams have actually been working with a lot of partners, including some municipal fire departments, the sheriff's department, home health agencies, and mobile partners to actually get in and get folks who are homebound vaccinated. So if you're in that situation, one of the things that we recommend is that you call our vaccine call line. It's the same call line that you call to help get an appointment, and we have that information and the number on our vaccinatelacounty.com website. You can indicate to the operator that you speak with that you are homebound and that you'd like to have vaccination offered to you at home. And they will collect that information and share it with our team that's helping provide vaccination to individuals that are homebound.
Dr. Ferrer, if I can add, some plans are also working on methods to vaccinate their homebound patients as well. So that's another group that you can talk to see if they are offering something that might also be helpful.
This a couple of questions for you as well that we could just transition to. The first one is, when do you expect the COVID vaccine to be FDA approved? If a college requires it before it's FDA approved, is it illegal? Could an individual or family take legal actions against a school?
That was for who, Dr. Ferrer? You were muted.
Sorry. I was for you, Dr. Davis.
Okay, thank you.
We'll stay with you.
No problem. So, it's interesting. I don't think we have a good prediction on exactly when the companies will submit for FDA approval, sort of what we normally see with medicines. But we know that they continue to collect data, and I would expect, before the end of the year, that they might do that, but we don't have, at least I'm not aware of an exact timeline on when they would do that. We are aware, and I'm going to tell you, I'm not going to give legal advice, but we are aware that some places are requiring it, and I believe that they are doing this based on what they believe is, and probably in a lot of real situations, is a higher risk of potential infection amongst in the setting, that they're requiring it. And we know that, in institutes of higher education, often close contact, multiple contacts, sometimes living in the same locations, congregate living settings, can all potentially be high risk. In terms of the legal advice around that, I can't give you any on that, but we are aware that organizations are really trying to assess their risk or potential for infections and outbreaks, which could severely impact the education that's being provided if those were to occur amongst the student populations.
Oh, thanks so much. And maybe, Dr. Balter or Dr. Davis, a couple of questions here. One is, if we were to have a severe reaction to a vaccine, but we don't have health care, what should we do? And here they're saying, I just mean like if I get really sick with my side effects, I can't really afford to get sick. So I'm thinking I just shouldn't get vaccinated. I don't know, Dr. Balter, if you want to start, and anybody else, please weigh in.
All right, well, to start with the side effects, many people don't have much in the way of side effects. They might have a sore arm. Then some people get fever, malaise, flu-like symptoms. These generally last no more than 24 to 48 hours and do not require medical care. The side effect that many people talk about beyond that is really a drug reaction, which is some people are allergic to the vaccine. That's very, very rare. And at vaccination sites, they are prepared to deal with that. The risks of that or the more serious side effect that Dr. Davis described is extraordinarily rare. And of course, if you don't get vaccinated, you also have the risk of getting COVID, which could land you in the hospital. So we do still recommend that you get vaccinated. You may be more comfortable getting vaccinated at one of the county sites, or if you have a provider, with your provider. But the side effects generally are pretty mild and are not going to require healthcare. Certainly less likely to require any sort of healthcare than COVID itself.
Yeah, I think that's important. And I also want to note that we have a lot of places in LA County for people who don't have a healthcare provider or don't have insurance where you can go to get your care free. So please, again, go to the county's website, and there's a whole list of resources there that will connect you to healthcare that won't cost you anything if you have no health insurance. And just for everybody's information, if you ever have any kind of serious life-threatening illness, or you feel really, really sick, please go either call 911 or go to an emergency room. Again, you cannot be turned away from any of our emergency rooms because you don't have health insurance. So you want to make sure everyone goes and gets care when they're really, really sick.
And I would just add one more thing, which is not having health insurance actually is a good reason to get vaccinated because it protects you against the risk of getting sick.
So, yes, I agree. Dr. Kurian, again, lots of questions on how can people get vaccinated. This one caller noted, the website is so complicated. Can I really just show up and get vaccinated? That's the only way I think this will happen for me.
Sure. And as I noted in some of my opening remarks, we really want to kind of let folks know that at our mass vaccination sites, we are allowing for folks to just walk up. And you don't need an appointment. You can walk up and get registered right there on site and get vaccinated. So we do have information on our social media channels just about where these vaccination sites are offered. We do have that information on our vaccinatelacounty.com. And it's pretty easy to access right there at the top. When you go to the vaccine page, you can sort of see where you can sign up to get a vaccine, and it has the places that you can get that are county mass vaccination sites. But you don't have to try and navigate the website. You don't have to try and get an appointment. You can definitely show up and register on site.
Yeah, I think it's really helpful. There's 8 sites that we have that you don't need an appointment, but I want to say there's 700 sites across the county, additional sites. And at many of those sites, you also don't need to have an appointment ahead of time. So it is worth your while to go look on vaccinatelacounty.com and figure out all the different sites that might be close to you, because there are many places right now that are trying to make it as easy as possible for you to get your vaccine. I also want to note that if you don't have access to a computer or the internet, we do have a call center. That number will either be put up at the end, or you can, or it was up at the beginning. It's right here. You can go ahead and call us. We're looking for the phone number where people can go to call us to make an appointment. Because again, you don't have a computer. I don't want you to think there's no way for us to help you. We do have a phone number. We'll get that to you shortly, where you can call, and one of our call takers will help you. You can also call 211, and they will help you make an appointment as well. So many different ways right now to get an appointment, and we have plenty of vaccine. So please, go ahead. This would be the time that it will be as easy as possible for everyone to come in and get vaccinated.
So I can share that phone number. It's 833-540-0473. Again, that number is 833-540-0473. And the vaccine call center is open daily from 8 to 8:30. So it is available 7 days a week. And as Dr. Ferrer mentioned, you can also call 211. In addition to helping you provide information about how to get an appointment, they are also helping folks who need transportation to vaccination sites. And as I noted earlier, they're also providing assistance for getting appointments for people who are homebound.
That's great. Dr. Davis, maybe you could help with this question. If you've already had the J&J vaccine, can you go ahead now and switch to one of the other vaccines, either Moderna or Pfizer, even though J&J was just a 1-dose vaccine? I'd like to do this because I want more protection.
Well, let me first say that hasn't been studied and it is not recommended. Once you get one of the vaccines, you are considered fully protected. And there haven't been any assessments, or studies related to if there's an issue having both doses. But at the current time, once you have finished one of the vaccinations, whether it's the 2-dose or the 1-dose Johnson & Johnson, you're fully vaccinated and there is no need or recommendation to get the other.
That's helpful. I don't know if anybody else wanted to chime in on that, but feel free. Otherwise, I'll move us on, because again, we have tons of questions that are coming in. And maybe Dr. Balter, you could start with this. Can you explain herd immunity, and what will that mean here in LA County?
So herd immunity, which is also sometimes called community immunity, is when enough people in the community have immunity, either through vaccination or through recent infection, that the virus really can't spread. And that's because, let's say I get COVID, but if everybody I come into contact is immune, either through vaccination or through recent infection, the virus can't spread any farther. It just stops. This is what happens with many childhood diseases from the past. We all have been vaccinated, or in some cases, among older people, they had it as children. And it just, even if somebody shows up with that infection in Los Angeles, it just can't take hold and spread. Polio is an example of that. What level of immunity is required for herd immunity in Los Angeles or anywhere is not known with COVID-19. And part of that has to do with the fact that it's a new virus. And then part of that was alluded to by people who asked the question about whether or not we will need a booster. Is the immunity that we're receiving from these vaccines going to last a long time, or is it going to fade? And how long the immunity lasts after you are infected. For some infectious diseases, once you're infected, you almost never get it again. That is unlikely to be true with COVID. We already know that some people have gotten it more than once. With other coronaviruses, we know that immunity fades within a year or two. So it's unlikely that natural infection will protect us indefinitely, but it does definitely provide some short-term protection, and we can use that time to vaccinate the community, which is essentially what we've been doing here in Los Angeles, to try to reach that level of herd immunity. But until you get to the level of people where so many people have been vaccinated, the virus can continue to spread from person to person. That's why we're still encouraging people to get vaccinated, even though a large number of people have been vaccinated. It's definitely not enough yet to prevent the spread of the virus.
I do want to add, as we talk about herd immunity, it is important that if there are pockets or places where there's lots of unimmunized people, the risk is still that the virus could spread there. So we could have 80% of our population here in LA County vaccinated, but certain areas have very low percentage of people vaccinated, and there's still the risk that the virus can spread in those areas. So that's why it's important, even when you think about pregnant women and the family who gets vaccinated against influenza for the newborn to protect and provide some herd immunity around the newborn. It's really, really important for the folks around you to be immunized and protected as we start to get towards this larger, countywide level of herd immunity.
Thanks. Dr. Kurian, again, questions. These are a great set of questions. I'm going to combine a couple here about how do I prepare for coming for my vaccination? Should I have a good meal before I come, or should I be fasting?
Good question. So yes, we definitely want people to make sure that they come prepared, drink plenty of water, stay hydrated, have a meal, take your medications that, your physician or your medical provider has asked you to take. There's no reason to come in fasting to get vaccinated. In fact, we really don't want you to do that. And we are also recommending that, maybe come in and with a snack and some extra water so that you can make sure that you stay hydrated while you're waiting in line, and have something to maybe eat even after you've gotten vaccinated or while you're waiting. So yeah, all of those things are really important. Please don't come in fasting.
Thank you. Dr. Davis, we've got a few questions here about variants. What kind of variants are we seeing in LA County? And do we know if the vaccines are working against them?
Yeah, I think so. What we are seeing is actually what the country is seeing as well, where we're seeing more and more of the B117 UK variant. We have seen the Brazil variant. We've seen South Africa variant, but so far as what we can see, the vaccines have been protective, and we've seen this across the country as well. So we've been fortunate in that regard. Now, whether or not we start to see other variants or there are new variants of concern that are more infectious, that cause more severe illness, that remains to be seen. But the more people that we have vaccinated, the less likely that a virus can infect someone, start to mutate and become a variant, or the less somebody picks up a virus in some other place or a variant in some other place and brings it here for it to spread. But at the moment, the B117 variant or the UK variant has been growing, and we've seen that across the nation as well.
Yeah, in California, we've also had what we call the California variant. Yeah. That tends to still dominate. But sometimes people ask us, like, how do we know that it's working? And the best we can do right now is give you just sort of real world examples. So at our skilled nursing facilities, about 75% of the workers and 75% of the residents there are now fully vaccinated. And we have almost no cases in our skilled nursing facilities. And, for those of you who aren't aware, there's like over 340 of these facilities that we're managing across the county. And you all know, like, there was devastating illness and death at these facilities. And now that people are fully vaccinated, our case numbers are really, really low there. Our outbreaks are almost non-existent. The same thing among healthcare workers. And the good thing about skilled nursing facilities is we actually do a lot of testing there because it's required by law. So we're able to also pick up on, those, if there's a handful of folks who are fully vaccinated and they've tested positive, we can still find that. But I'm just saying we have almost no cases there. And healthcare workers, there's really over 200,000 of them that hundreds of thousands of them, 700,000 of them. And among healthcare workers, we've been tracking from the beginning of the pandemic how many healthcare workers on average are infected each week. And even before the surge, even before we had all of the tragedy of huge numbers of cases, we've always averaged somewhere between 400 and 600 healthcare workers getting infected on a weekly basis. They had a lot of exposures. For the last 4 weeks, that number has been less than 50 a week. And again, that's a workforce that there's been just a lot of folks are fully vaccinated. And the last example is at our schools, because again, here's a place where teachers and staff are also high numbers of them fully vaccinated. Before we had many people vaccinated in these settings, the majority of our cases that were diagnosed among people who were working at schools or attending schools were frankly among teachers and staff. Many of these cases were community acquired. There wasn't a lot of spread in schools. We had very few cases among our students. And so the most cases were so like 75% of cases were teachers and staff. Now we still have very few cases in our school settings, but for the first time, the majority of cases are actually among students and not among teachers and staff. And that, again, is teachers and staff much more likely to be vaccinated. So just a lot of real world examples. These aren't, research papers or studies we've done, but when we look at our data and we look where we have groups of people where lots and lots of them got vaccinated, we're just seeing very, very low numbers of cases. And that's actually the good news for all of us. Dr. Balter, maybe you could help. There's some questions about, for people with underlying health conditions, are the vaccines really safe? What if I have allergies to other medications like penicillin? So I don't know if you want to just sort of tackle sort of safety of vaccinations for people with underlying health conditions. Same thing, something about blood clotting. If I'm prone to blood clots, I'm on warfarin. Should I be worrying and not getting vaccinated with J&J or just not getting vaccinated at all?
All right, there's a lot of questions to cover there. First of all, people with underlying medical conditions in general, as a broad group, are absolutely encouraged to get the vaccine. Those are the people who are at higher risk for serious illness. So everybody who has an underlying condition that they're concerned about should talk to their doctor as soon as possible and most likely go directly to get vaccinated. In terms of allergies, many people have allergies, including very serious allergies, and can safely get COVID vaccine. So unless you have an allergy to a specific component that's in the vaccine, and again, you can talk to your doctor, and if your doctor doesn't know the answer, you can work with a pharmacist. But for something like penicillin or other antibiotic allergies, food allergies, those are not contraindications to the vaccine. However, we do watch people who've had allergies like that before, who've had what we call anaphylactic allergies, or if you're somebody who carries an EpiPen, we watch you for longer, just to make sure that you don't have an allergic reaction. But absolutely, you should go ahead and get the vaccine. And overwhelmingly, most people will not have a reaction to COVID vaccine, even though they've had a serious allergy to another medication. Now, in the case of a clotting disorder, specifically when talking about J&J vaccine, you should talk to your provider. There are a couple of disorders. There's one called Heparin-Induced Thrombocytopenia, which is somewhat similar to the syndrome that the vaccine induces, where there are a lot of questions, and you may want to avoid it and talk to your provider again. For most clotting disorders, however, it's not going to be a contraindication. But the best approach, for example, if you're on warfarin, is to talk to your doctor and say, do I need to be concerned about this? But if you are on warfarin, chances are you do have some underlying medical condition that will put you at a higher risk if you get COVID. So we absolutely want to make sure that you do seek the vaccine, whether you choose to get Johnson & Johnson or one of the other 2 vaccines at your doctor's advice.
That was great. And again, we're not going to get to every single question about everyone's illness, but I think Dr. Balter gave you a really good advice. So if we didn't answer the question about your specific condition, please talk to your healthcare provider. That would be especially important if you have questions about whether this vaccine is appropriate for you. We do have a whole host of questions about how these vaccines work. And before we transition to really answering questions about what can you do when you're vaccinated, because I want to give us plenty of time to answer those questions. They're really important. What's okay to do now that I'm vaccinated? We got a lot of questions about that. I do want to, perhaps ask anybody to sort of start on this is, what is the way these vaccines work to help us develop antibodies on the virus if you're actually not injecting the virus into the body? And why would 2 of the vaccines require 2 doses and one requires only 1? I don't know who wants to start, but feel free.
Well, so the Pfizer vaccine and the Moderna vaccine are very similar vaccines. They're a new technology called mRNA. There's a little piece of mRNA that is not the virus, that does not become part of you in any way, but it goes into the cell and it teaches the cell how to make the protein that looks like the virus. So your body will recognize this and make antibodies against it without you having the virus, which is this great thing. So the body essentially is using its own natural system to create immunity to the virus. Then the mRNA gets degraded and goes away. The Johnson & Johnson vaccine is a different kind of vaccine that uses an adenovirus. And again, it doesn't use it doesn't infect you with the virus. It's just a piece of the adenovirus. And again, it stimulates your body to think that you have COVID vaccine and create the antibodies. Because it's using a different mechanism than the other 2, they were able to do one shot rather than 2 shots. And that's essentially the difference, the reason that there's a difference. But none of the vaccines involve actually giving you COVID. Instead, they stimulate your body to use its own natural immune system to create the antibodies and be ready if you do later on get exposed to COVID. Dr. Davis, I don't know if you want to add anything.
No, I think you covered it. It was kind of funny because I thought Dr. Kurian was going to take that one.
I'm sorry, Dr. Kurian.
No.
I think you did a great job, Dr. Balter. I think you got it covered.
Maybe Dr. Kurian, I'm going to flip us just a little bit because we got dozens and dozens of questions about what can I do or what can I not do now that I'm vaccinated. So maybe we'll start with the first one. My parents and I are fully vaccinated. My parents are in their 70s and my father has high blood pressure. Should I still be wearing a mask when I visit them inside their home?
Sorry, Dr. Was that a question for me?
Yes.
Okay, perfect. Sure. Yeah, the current recommendations is that, if everyone is fully vaccinated, then the requirement to wear a mask or some of the requirements that we have around distancing is not required. Of course, for individuals that have, underlying medical conditions, again, when you're going outside, and really for everybody, even if you're vaccinated, it is important when you're outside of your home to continue to use some of those precautions that we're recommending, like using your mask, social distancing, washing your hands. So all of that is important outside of your home. But if you're inside with other people who are fully vaccinated, then yes, you don't have to wear the mask or do the social distancing.
And then maybe Dr. Davis, a similar question, but slightly different, and we got a few questions just like this. If a child is not vaccinated, can vaccinated adults be maskless around the child, particularly indoors?
So in this instance, this is sort of a bit of herd immunity in terms of everyone else is fully vaccinated. Much less likely that you're going to get infected and pass it on to the child. So that is okay to do.
So, and I'm going to just keep going on this, sort of with all these questions about how we can sort of interact with each other once folks are fully some folks are vaccinated. And feel free, Dr. Balter or anybody to answer. Is it okay to spend time indoors with an unvaccinated family if I'm vaccinated and all the people with me are vaccinated?
In general, the answer to that question, if there's only one unvaccinated person and everybody else is vaccinated, is yes, it's okay to spend time indoors. The exception would be if you had somebody who was extraordinarily vulnerable, say somebody on chemotherapy who might be severely compromised. In that case, you may wish to take precautions and wear masks around that person.
Yeah, I was going to reiterate that as well with that question about the child. If the child is at high risk of severe illness, better to be more protective, even if you're fully vaccinated.
If I'm going to just keep going, and anybody can chime in at this point, because these are all just really good questions, I think, about what can I do. I saw that this is a question from a caller. I saw that the CDC is now saying that people who are vaccinated don't need to wear their masks when they're outdoors. Do you think that's good advice? And how would are you concerned that will allow there to be more spread?
Again, it depends on the situation. I think that if you're outdoors alone exercising, if you're with a few other people and they're vaccinated, absolutely, it's perfectly reasonable not to wear your mask. Even the CDC did recommend, however, that if you are in a crowd, where if you think about it, if you can't stay 6 feet away from people, if you're at a very large gathering or concert or protest, or just in a crowd, say on a boardwalk, that they do still recommend wearing masks for exactly the reason that you brought up, that there could still be a risk of spread.
A follow-up question to that is, when will we be able to stop wearing masks, all of us?
That's a great question. I think even, as we look and we've seen information from the state alluding to, somewhere around June 15th, we would not have the blueprint tiered system. Even in that, there is, some comment that masking may still be required, in certain locations. But I think as we go through and we continually assess the potential risk and look at how many people are fully vaccinated and protected, against COVID-19. We continue to make assessments, as will the CDC and the state and many other locations about, what the recommendations are. But we're getting to that point where we are seeing more and more relaxation of, a lot of the restrictions as our case counts have come down. But we still need to be cautious because many people are not fully protected with a vaccine against COVID-19.
Yeah, and just, there's so many questions that they came in on this. Also, this topic of masking. Should children who cannot get vaccinated still be masking outside?
Again, I think it comes down to that question of are you in a crowd? Are you, with your family? If you are vaccinated, if a child is out with the parents and the parents are vaccinated, it's fine then for them not to be wearing their mask. But if they're in a crowd, children are still vulnerable to COVID-19 because they are not vaccinated. They're less vulnerable than adults, we found, but they definitely still can get COVID-19. So if they're in a crowd, we would recommend that they wear that they wear masks, at all times, or when they're around people who are not vaccinated.
Yeah, and just to be clear, children at schools, they all need to be wearing their masks. When children are outside playing, they all need to be wearing their masks. Children are not vaccinated, young children are not vaccinated, and at this point, they are required to wear their masks. So I think we should make sure that, we're clear about there are settings where there's a requirement for children to wear their masks, and please, know that in those settings, your children do need to continue to wear their masks. There is, there are a lot of questions about what that means, like at social gatherings. So our families are getting together. Everyone who's an adult is fully vaccinated, but the kids aren't vaccinated. Can we just go ahead and have that entire event without our masks on? So there are three questions. The same question about I'm getting together with a bunch of families. We're all vaccinated as adults, but none of our kids are vaccinated. What do our kids need to do in that setting?
Well, currently, the way things are, if you're fully vaccinated and meeting with other fully vaccinated people, you could meet with one other household with unvaccinated people, as long as no one in that household is at high risk for serious illness or death from COVID-19. What Dr. Ferrer just described is more than one household with unvaccinated people. And the recommendation at that point is really that masking is still required. And I will note that even the CDC guidance did not change masking requirements for people who are unvaccinated. It really just talked about people who are fully vaccinated.
Yeah, I think that's really helpful. So please, your children, when they're not with their household, they'll still need to be fully vaccinated. And at schools, camps, daycare, please make sure that you're helping them adhere to all of those rules that really keep everyone safe in those environments. There's a couple of other questions that I think are important for us to try to answer, which are really now more related to, work sites and what are the rules at work sites. So there's a lot of questions that came in about like, what can I do socially? But there's also questions, if everybody in my office is fully vaccinated, why do we need to wear masks?
Well, I think it comes back to what we said earlier, which is that you can still become infected if you are vaccinated. Inside is definitely not nearly as safe as outside. And also, often in the workplace, we encounter people who are not fully vaccinated. So the guidance from CDC currently still states that everybody needs to be wearing their mask indoors, even if you're fully vaccinated. However, I am sure, as you've seen, as more information comes in, as we have more time to study the vaccines and who isn't getting sick and to see what happens, then this guidance is is reviewed, and everyone decides whether or not it's still necessary. And so this is an area that everybody continues to review, but the current CDC guidance still recommends masking indoors when you're with multiple households.
Yeah, thanks. Thanks so much. I don't know if Dr. Davis or Dr. Kurian, you wanted to add on that, because again, I think there are a lot of good questions about not understanding the different rules in different locations.
No, I think Dr. Balter answered it. I do want to just add something to your earlier question about, what can fully vaccinated people do. The one other important thing is, after traveling, domestically or even internationally, you don't need to quarantine or test if you don't have symptoms, on your return. So that's another benefit. You still need to take precautions as you travel, but those are one of the things that you wouldn't have to do on return.
There's another set of questions that came in. If I'm fully vaccinated, do I need to participate in my workplace's screening program? I don't know if that's a screening and testing program, but let's make it screening including testing, just because I think other people were asking that earlier as well. If I'm fully vaccinated, do I need to participate in this sort of screening testing? And, probably we should differentiate. If you're fully vaccinated, the only time we would relax any of the rules would be if you were asymptomatic. So I want to note that if you've got symptoms of COVID, even if you're fully vaccinated, you need to do what everybody else does when they have symptoms: stay home, isolate yourself, and get tested. But asymptomatic, fully vaccinated people, do they need to do testing and screening surveillance at their work sites?
So the answer is no at this point. The CDC also provided some information about that as well. The risk in that instance is having a false positive test, and that causes a number of other problems, just in terms of trying to make sure that it's not a real positive. And we're also looking at that same guidance, and we'll come out with something probably this week as well in relationship to that.
Dr. Balter or Dr. Kurian, did you want to add about sort of the testing issue for fully vaccinated folks?
No, I think Muntu, you've covered it really with the risk of the false positives. Especially when you're in a situation where you've got a vaccinated individual and the risk that they could actually have COVID being pretty minimal, the chances of that test result coming back as a false positive is much higher. So I think that's a really important point that Dr. Davis brought up.
So I think we're going to go to sort of another set of questions that we got, really very much related to vaccine hesitancy. And it would probably be helpful for everyone to chime in on the answers to the next couple of questions. The first one is, what are we doing to convince people to get the vaccine? My uncle doesn't want to get it, but he doesn't really have any good reasons. He just says he wants to wait. What advice can you give me? Dr. Kurian, do you want
I can start. Yeah, sure, I can start. And we're definitely running into this, I think, more and more, where people have been, there's been a couple of different issues, right? So initially it was accessing the vaccine, and folks sort of not really getting vaccinated right away just because they were having a hard time. And that's sort of fallen away as a real issue. So we're seeing more and more of those folks who were, watching and waiting, and then also folks who really have, significant concerns. I think, one of the things that we, again, sort of offer on our website is a lot of great documents and information about, for example, some of the myths versus facts about vaccine. So I really recommend, for folks who are trying to have these difficult conversations with family members or friends about really, why should you get vaccinated? Check out some of those documents. and sort of get educated yourself about what does it mean to get vaccinated? Some of these really wonderful questions that people have brought up about what are the benefits of getting vaccinated? What can you now go out and do because you've been vaccinated? All of those things are, I think, really good information for you to kind of get information on so that you can share with folks. Because, honestly, those people are probably going to be listening to you and really, you're going to be a primary source of information for them. So, really take this opportunity to get educated yourself.
Dr. Davis, any additional advice?
No, I think she got it.
Dr. Balter?
You might also offer, if it's, your uncle, to take them to a vaccine site, might take them to a pharmacy where it's available, anything you can do to support them. Sometimes if you ask on different occasions, people might think about it more, especially after they see your own experience. So we encourage everyone to encourage their friends and loved ones to get vaccinated so we can protect the whole community.
As I think about it, there's one thing I would add. Sometimes the biggest stumbling block for people is actually making that appointment or that process of making it. It just seems hard and overwhelming, and sometimes scary for some people. Some people do better if you go with them and you're supporting them, through that process. And I would encourage that support. For people who, may be hesitant and, are saying that, but continuing to have the conversation, sometimes providing additional answers, additional information, sometimes does help to change people's minds.
Yeah, I think it's such an important question, and there's so many different ways to answer. One thing that, we're very lucky here in LA County is we have a lot of partners. And sometimes if you're struggling to, give information to somebody that might help them think about vaccinations differently, you might also be able to look towards your clergy. If you're a person of faith, you might be able to ask this person's provider if they're in touch with a healthcare provider, or even some of their friends. I mean, sometimes if you hear it from other people that you trust, not just from one person, it becomes easier for you to accept that it probably is okay to get vaccinated, and it probably makes sense. And I also think acknowledging that, really lots and lots of people are scared to get vaccinated. I don't think that that's a really rare event to be scared to get vaccinated. This is a new virus and it's a new vaccine. And I think it makes a lot of sense that people might feel scared and that they might want a lot of information and that they might have wanted to wait and take their time and see how this is going. So, I think we also need to probably have patience. And it's hard to have patience right now because it's so important for us as a community. Like the community safety issues are huge. But I don't think it helps to be impatient with people you love and you care about who are still hesitant, because it's okay if people are scared. And I think we do lots of things in life, though, even though we're scared. And sometimes it's important to remind people that we've got a lot of courage that gets us through some of the harder times we've all had. And certainly getting through this pandemic, many of us, if not everybody, has had to show a lot of courage. So, vaccinations are one of the most powerful tools we have right now. But I think making sure that people feel supported in their decision making is also going to be important for all of us. I do have one last question, and again, would ask everyone to feel free to chime in, because I think there are probably a lot of people who feel this way, and I want to appreciate the person who sent us this question, because I think they're saying something that other people are feeling and haven't really felt okay about saying to us, especially. Look, this person says, cases in LA County have dropped really quickly and a lot. And there are hardly any people in the hospitals and dying anymore from COVID-19. So why do you keep asking us to go get vaccinated with new vaccines? It seems like where we are now is okay, that either enough people have been vaccinated or been sick with COVID that we've got all the protections we need to keep going on our recovery journey. So I appreciate the person who asked public health people this question because of course, this is top of mind for many of you. And I think we talked about it as herd immunity, but it's also like sort of your personal decision about why am I going to bother right now where there doesn't seem to be a lot of risk.
I'll start, but before I start, I want to correct something I said earlier. For fully vaccinated people and returning from international travel, there is a recommendation that you be tested 3 to 5 days after your return. And part of that is related to potential variants to the virus that could be more infectious and could have infected you. They're always changing. But I also want to say that that's also one of the reasons that we are still recommending that you still get vaccinated, even with this low number of cases that we're seeing. As we look over the pandemic, we've seen peaks and valleys in terms of cases. We've had 3 surges in cases, each one of them with a different size in terms of magnitude. And we've seen the same ups and downs along with those cases in terms of hospitalizations and deaths. The things that worries us the most is one, understanding how long the vaccines will be protective. We hear that there may be boosters, and that's great that the pharmaceutical companies are thinking about that. But the other is that the virus continues to change. And we don't know if those changes are going to escape the vaccine at some point. But the more people that are protected, the less infections there are. That's more sure than waiting on a variant that might be more infectious and cause more disease and death than anything that we've seen thus far. So we want to make sure that as many people are protected now as possible so that there isn't that risk of a virus becoming a variant that then creates the new surge for those who are not protected and cannot be vaccinated because of some underlying health condition.
Thank you. Dr. Kurian?
Sure. Yeah. I think we are where we are today because of, a lot of the precautions that we've put in place, a lot of the hard work that people have done to go out and try and get vaccinated. But we're not done yet. We definitely have not vaccinated as many people as we really need to vaccinate here in LA County to make sure that we protect all of those who are vulnerable and can't get vaccinated or, are just are really high risk of getting very, very sick from COVID and potentially dying. So we're at a good place today. And as as all of the doctors on the panel have noted, we still have a way to go and we still have work to do to make sure that we continue to protect people. So we really need to continue to motivate folks to get vaccinated and do what we can and continue those precautionary measures that we have in place as well.
Dr. Balter?
Yeah, and I would also add that you're absolutely right. We are in a good place. And I think many of us are incredibly grateful after the really, really hard winter we had where there was so much suffering. But we also see other parts of the country that have vaccination rates similar to ours that are not in such a good place. And COVID is still a relatively new virus about which we do not understand everything. And we still, as Dr. Kurian pointed out, have a fair number of restrictions and precautions in place, which we got many questions about when they could be lifted. And it is probably going to take many, many more people getting vaccinated in order to reach that point. But we also worry that without vaccinating more people and potentially in the future even having booster vaccines, that we will not be able to indefinitely protect the community from the kind of suffering that we have so recently seen, and which we all hope we will never have to repeat. So that is the reason that we continue to encourage people to get vaccinated.
Yeah, I think, we're also, as our wonderful panel has noted, we're public health, so we're always going to worry about everyone in our community. But I'd make this personal as well. For those people who aren't vaccinated, you still have risk, a pretty high risk when you get infected of getting pretty sick and even passing away. So the numbers are way down, but on average, we report somewhere between 5 and 10 people still die every day here in LA County from COVID. 400 plus people are in the hospital every day with COVID. And we have, on average, 400 to 450 new cases every day. And amongst those people, the vast majority of them are not vaccinated. So the people who are the new cases, the people who are still ending up in the hospital, and the people who are still dying are, for the most part, people, they're almost all people who aren't vaccinated. And I don't want that to be you, and I know your family doesn't want it to be you. So we could think about the protections that we get as a community. But I also know that, you all belong to families. You have friends, you have people who love and care about you. And this is a risk at this point that your risk of getting infected, getting seriously ill, and dying is far more, it's a far greater risk than any of the risks that are associated with getting vaccinated. So again, our goal right now is to keep everybody alive, make sure that people can get vaccinated, and that they can go ahead and protect themselves. So, look around your friends and your family and help each other make decisions that really make sure, we all get through this together. And by getting through it together as we keep each other alive as well. With that, we're at the end of our time with you. I want to thank everyone so much for being with us today, and I want to especially thank Dr. Davis, Dr. Kurian, and Dr. Balter for joining us. There is more information, as we've noted, on our website, so vaccinatelacounty.com or vacunatelosangeles.com. These are places where you can go and download information about vaccines, answer your questions, deal with any misinformation you have, but also get connected to sites where you can go ahead and get vaccinated. So thank you very much. We'll be doing these more frequently and really want to appreciate everyone who sent us in their questions. With that, good night. Buenas noches a todos. And we look forward to continuing to work together.